Vitamin B12 is one of those nutrients you might not think about often, but your body relies on it every single day. This essential vitamin keeps your nerves functioning properly, helps create healthy blood cells, and plays a starring role in your energy metabolism. Let's get into what makes B12 so important and how to make sure you're getting enough. What makes vitamin B12 special? Vitamin B12, also called cobalamin because it contains cobalt, is a water-soluble vitamin with some remarkable responsibilities in your body. Unlike some nutrients that do just one or two things, B12 is a true multitasker. First and foremost, it's essential for creating healthy red blood cells. Without enough B12, your body produces abnormally large red blood cells that can't do their job properly, leading to a type of anemia. B12 also protects your nervous system by helping to maintain the protective covering around your nerves, called myelin. This is why B12 deficiency often shows up as tingling in your hands and feet. Perhaps most importantly for daily life, B12 helps convert the food you eat into glucose, which gives you energy. It's also crucial for DNA synthesis, the process your body uses to create new cells. How much do you actually need? The good news is that you don't need massive amounts of vitamin B12. Adults need just 2.4 micrograms daily, that's 2.4 millionths of a gram. To put this in perspective, a 3-ounce serving of salmon provides more than your entire daily requirement. Pregnant women need slightly more, 2.6 micrograms, and breastfeeding women need the most at 2.8 micrograms daily. Children's needs range from 0.4 micrograms for infants up to 1.8 micrograms for teenagers. Where to find vitamin B12? Here's something crucial to know: vitamin B12 is naturally found only in animal products. This makes it unique among essential nutrients and particularly important for vegetarians and vegans to pay attention to. The best sources include clams, which are extraordinarily high in B12, beef liver, fish like salmon and tuna, red meat, poultry, eggs, and dairy products. A single 3-ounce serving of clams contains over 700% of your daily needs, while a cup of milk provides about half. If you follow a plant-based diet, don't worry, you have options. Many breakfast cereals are fortified with B12, and nutritional yeast, a popular vegan ingredient, often contains significant amounts. Just check the label to make sure it's fortified. Some plant-based milk alternatives are also fortified with B12. How to recognize its deficiency? Here's something that makes B12 deficiency tricky. Your body stores enough B12 in your liver to last several years. This means symptoms of deficiency can take a long time to show up, sometimes 3 to 5 years after your B12 levels start dropping. Early signs include persistent fatigue, weakness, and lightheadedness. As deficiency progresses, you might experience numbness or tingling in your hands and feet, difficulty walking or maintaining balance, memory problems, or mood changes. Some people develop a swollen, inflamed tongue that appears smooth and red. The challenge is that these symptoms can be subtle at first and are often mistaken for other conditions, especially in older adults. This is why awareness is so important. Who's at risk? While most Americans get adequate B12 from their diet, certain groups need to be more vigilant. Older adults top the list. As we age, our stomachs produce less acid, which is needed to separate B12 from the proteins in food. Studies show that 10 to 30% of older adults have difficulty absorbing B12 from food sources. Vegetarians and vegans face an obvious challenge since B12 is naturally found only in animal products. If you follow a plant-based diet, fortified foods and supplements aren't optional, they're essential. People with digestive disorders like Crohn's disease, celiac disease, or those who've had gastrointestinal surgery may struggle to absorb B12 properly. The small intestine is where B12 absorption happens, so any damage or alteration to this area can cause problems. Medication users should also take note. If you regularly take medications for acid reflux, like Prilosec or Zantac, or metformin for diabetes, these can interfere with B12 absorption over time. This doesn't mean you should stop taking these medications, but you should discuss B12 monitoring with your doctor. People with pernicious anemia, an autoimmune condition that prevents B12 absorption, are at the highest risk and typically need lifelong B12 injections. What about supplements? B12 supplements are widely available, safe, and inexpensive. They come in several forms: pills, sublingual tablets that dissolve under your tongue, nasal sprays, and injections, which require a prescription. The most common form in supplements is cyanocobalamin, though you'll also see methylcobalamin and other forms. Research shows they're all effective, so don't worry too much about which type to choose. Here's reassuring news: vitamin B12 is extremely safe. Even at doses much higher than you need, there are no known toxic effects. Your body simply doesn't absorb excess amounts, and what it does absorb is easily eliminated. This is why there's no upper limit set for B12 intake. Separating fact from marketing hype. You've probably seen B12 promoted as an energy booster, especially in energy drinks and supplements marketed to athletes. While B12 is involved in energy metabolism, the reality is more nuanced. If you're already getting enough B12, taking more won't give you extra energy or improve athletic performance. It's like filling a gas tank that's already full. The extra just spills out. However, if you are deficient in B12, supplementation can dramatically improve your energy levels and overall well-being. Similarly, while some studies have found associations between low B12 levels and cognitive problems, clinical trials haven't shown that B12 supplements improve memory or prevent dementia in people who already have adequate levels. The relationship between B12 and brain health is complex and still being researched, making it work for you. For most people, getting enough vitamin B12 is straightforward. Include animal products in your diet regularly. A varied diet with fish a couple times a week, some meat or poultry, eggs, and dairy products will easily cover your needs. If you're vegetarian or vegan, make fortified foods a daily habit. Start your day with fortified cereal, use nutritional yeast in cooking, and choose fortified plant milks. Many vegans find it easier to simply take a B12 supplement to ensure they're covered. If you're in one of the higher risk groups, over 50, taking medications that affect absorption, or have digestive issues, talk to your healthcare provider about testing your B12 levels. A simple blood test can reveal whether you need to boost your intake. Vitamin B12 might be needed in tiny amounts, but its impact on your health is enormous. From keeping your blood healthy to protecting your nervous system, this essential nutrient deserves attention. The good news is that for most people, getting enough is easy through diet alone. And for those who need extra help, safe and effective supplements are readily available. Pay attention to your risk factors, eat a varied diet, or choose fortified foods if you're plant-based, and don't hesitate to discuss B12 testing with your doctor if you're concerned. Your body, and especially your brain and nervous system, will thank you for it.